The information shared on the Sky Women's Health podcast is for educational and informational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding your medical condition. Never disregard professional medical advice or delay in seeking it because of something you heard on this podcast. Reliance on any information provided by Sky Women's Health, Dr. Carolyn Moyers, or any guests featured on the podcast is solely at your own risk. You're listening to Sky Women's Health Podcast, your evidence-based resource for women's health and wellness, exploring the holistic principles of osteopathy, integrating mind, body, and spirit, designed to empower you as your own healthcare advocate and help you live your best life. I'm your host, board-certified OBGYN, Dr. Carolyn Moyers. Welcome back to Sky Women's Health. Hot flashes, sleep disturbance, brain fog, weight changes. These are the symptoms of menopause that get talked about. They're the ones that show up in the articles, in the clinic visits, in conversations with your friends, but there is an entire category of symptoms that women are experiencing and largely suffering through in silence that almost nobody is connecting to menopause. Bloating that wasn't there 5 years ago, constipation that came out of nowhere, abdominal discomfort that your doctor keeps investigating and never quite explaining, a gut that just doesn't behave the way it used to. This is not random. This is not just aging, and it is not in your head. Your GI tract is deeply hormone sensitive, and when estrogen shifts, your gut shifts with it. And the problem is that almost no one is telling women this, not explaining what's happening, not connecting the dots, and not giving them a roadmap for what to do. That is what today's episode is for. As you know, I'm Dr. Carolyn Moyers, board-certified OBGYN, Menopause Society certified physician, and ISHWISH fellow. And my guest today is Dr. Dawn Sears, a gastroenterologist and hepatologist and clinical professor at UT Southwestern Medical Center. She cares for veterans at the VA of North Texas. She has spent decades building and leading GI programs and brings a level of clinical depth and straight talk to this conversation that I think you're really going to appreciate. Beyond her clinical work, she also coaches women physicians through her brand GutGirl MD, helping them thrive in medicine and in their health. Dr. Sears, welcome. I'm so glad you're here.
Thank you so much, Dr. Moyers. It is a pleasure to be on this parallel journey with you, empowering women in all the ways. And I love being able to talk about the guts, and I love being able to talk about poop in all the places.
That's right. That's right. You probably talk about poop like I talk about vagina.
Correct. Pretty much. Embarrass my children to no end.
That's right.
That's my superpower.
That's right. I know. At brunch, I'm talking about the clitoris and the vagina, and people are looking like, oh my God.
Yes. Horrifying my children talking about FMT, fecal microbial transplants, on a random mission trip through Guatemala. And they're like, Mom, shut up. I'm like,
Can we have one day when we don't talk about poop, Mom?
Exactly. Dinner table conversation, whatever. It's all good.
It's all good. Well, you use a really vivid metaphor, the GI tract as a laundry room. Can you talk us through that? What are the machines? What do they do? What happens when they break down?
Absolutely. So basically, us women, our laundry rooms are different than the boys. We are very familiar with laundry rooms as women, as a general rule. So the esophagus is our laundry chute, and that leads us to the laundry basket, which is your stomach. People think digestion occurs in the stomach. It doesn't. That's just where we kind of throw all the darks and the lights together, right? It's just a storage unit, okay? And then it's going to go into a small chute into the actual washing machine. That is putting things in the washing machines, putting things through the duodenum, the small intestine, into the small intestine where we're going to absorb things. Now we're going to mix it with detergent and maybe fabric softener, maybe bleach. So that is pancreatic enzymes, that is bile enzymes, that is digestive enzymes, right? And so if your enzymes aren't right, you've got a cousin who's an alcoholic who his pancreas doesn't work. He's got poopies all the time that float and won't go down the potty when he flushes, things like that, right? And so that is the small bowel where you actually digest food. And then you're ready to to get rid of the food. And so you have to dry it out. So the colon's job is to be the dryer. So you're moving the clothes from the washer to the dryer. That is going through the ileocecal valve of our bodies. And when it goes into the colon, it goes into your right lower quadrant next to your appendix, and it moves up, over, across, down, and around. And all its job is to dry it. And so if things stay in the dryer too long, then they end up crispy. You're pushing out rabbit pellets. So if you refuse to use public restrooms, you're telling your colon, please dehydrate my poop more, which is probably not really what you want. So you need to use those public restrooms, ladies, and you need to have that bowel movement. Let it go, be Elsa, let it go, right? But if you go too fast, then you're pulling it out after you've only had it in the dryer 3 minutes. Well, of course, it's soggy, it's wet. It's called diarrhea. So that's how it works. Well, a woman's GI tract is different than a man's because boys and girls are different. Our bodies are designed for different things. We need to absorb more water. Why is that? Because we have boobs. We have to make milk for babies. So we literally have longer, more twisty colons. Plus our colons have been a little bit, abused and involved with other processes, usually involving hysterectomies, involving having babies. So we end up with this wild roller coaster ride where a male colon looks like that. It is just up, over, down. Woman is all over that. So we get gas trapped. We have more movement, and we are prone to much more constipation than men because our colons are on high all the time. So if you are also taking in junk, taking in Twinkies and Diet Coke, and you're putting it in the washing machine with your lingerie, you're not going to get as clean as you should be. And so we've got to pay attention to the quality of things that we're mixing together of putting the dirty sneakers in with the lingerie. Don't do that. Your body doesn't deserve dirty sneakers. So put good stuff in there.
Okay, so I think that most of us have this assumption that the GI tract is kind of gender neutral. A stomach is a stomach, but we know that that's not true. So how does the hormonal environment, estrogen, progesterone, actually affect the GI function? What are those hormones doing down there?
Well, as we know, with pregnancy and all these other things, it changes strength or weakness of things. And if you're not having hormones where they should be, everything gets a little bit more lazy, a little bit more stretchy, and you end up with more gas and things. When you end up with gas and you end up with dysmotility, dysmovement, you also end up with bacteria that are happily, usually our friends that are breaking things down for us, but then you end up with little pockets of bacteria in different places that shouldn't be there. Bacteria will break anything down, but they're super sloppy. So they leave behind lots of gas. So then you end up with even more bloating. So you already have baseline gas, and then you have these pockets and areas that aren't moving things through as quickly. Then it's more fermentation and even more gas. So of course we get more bloating when our hormones are not where they should be.
Is there a particular phase of the menstrual cycle or the menopause transition where the GI symptoms tend to spike? What are you seeing clinically?
Yeah, every woman is going to notice their patterns for themselves. And a lot of women will say that right as they're starting their period, they end up with their GI tract just releasing, just all this cramping, all this diarrhea, all this changing as the hormones are whoosh, whoosh, and going back and forth. So we see it regularly, and every woman is going to notice their own cycles of the bloating right before the periods and maybe the diarrhea at the same time as she's pulling out her tampon. She wishes she had a tampon for her rectum at the same time because she's going regularly. And then they go back into a constipation cycle often.
When we're having normal menstrual cycles, we're accustomed to this regular pattern, like you just explained. But in perimenopause, we have this erratic fluctuation in our hormones, and then in menopause, they flatline. So, what are we seeing then?
Well, during perimenopause, we often see irritable bowel syndrome, which is much more common in women, and dyspepsia, which is much more common in women, go crazy. And so women are saying, I can't swallow, I feel the reflux, I'm feeling diarrhea, then I'm having constipation, then I'm having bloating, then I'm having gas, and I just feel like things are not right. And they're right because they're not right. And then when we get to menopause, often it is just the colon is just gone on strike and doesn't feel like working. So you feel a lot more bloating and you feel a lot more constipation. at this time, also, you may be dealing with some bladder issues and you may be nervous to drink water because you're afraid that you're having incontinence. So you unintentionally are decreasing what the body is needing because the body needs water for eyeballs, hair, everything. And so if it doesn't have water, it turns the dryer on high for you and it starts making those rabbit pellets. And then the rabbit pellets sit there even longer and you get more bloating. So we have to drink even more water when we go through menopause. And that is the most common complaint I see in my menopausal women is the bloating and the constipation.
Yeah, I agree. The bloating can be really bothersome. If you had to pick one thing every woman in her 40s and 50s should understand about her GI tract that she almost certainly doesn't, what is it?
It is that it requires constant maintenance and it is in constant evolution. So, what worked for you one day will not work for you the next day. And that is so frustrating. So, it's kind of like dealing with a toddler. What worked for them on Tuesday is not going to work 2 weeks from now. So, we all lose the ability, 100% of us, to break down lactose as we get older. Now, some days we get away with it more than others because the bacteria is breaking down the lactose for us, but all of us will lose it. So when I tell women that the number one thing that's worsening their bloating and their diarrhea and their irritable bowel and sometimes their constipation is lactose, they say, well, I don't drink milk every day. I don't care. Are you putting cheese in your salad or are you eating lasagna or pizza or putting creamer in your coffee or having an occasional, cup of ice cream? Every little bit adds up. And you're absolutely right. Some days you may have been able to get away with that half a cup of ice cream, but another day you're incredibly bloated and having horrible diarrhea after you have a piece of lasagna. So you just don't know. So basically at the bottom, we have this bacteria that is usually working with us, but occasionally against us. And we need to keep that primed. We need to keep it happy. The things that feed a good bacteria that make us happy and that we can work together are going to be fruits and vegetables. The more fruits and vegetables you give, the more the happy, good bacteria are going to be down there. But then there's also the inflammatory microbiota. So that's going to be E. coli. That's going to be C. difficile. This is going to be Salmonella, Shigella, all the things you hear about as, the cruise ship diarrhea with all these things that can happen, right? That is fed with junk food. So fried foods, processed foods, sodas, high fructose corn syrup. So if you want more nasty bacteria, then drink that Diet Coke every once in a while. And you think, oh, it's no big deal. It's no calories. It's not really hurting me. It is hurting you because it's empowering the bad guys down there, which are making more gas and more bloating. So every day we're always tending a garden, a beautiful garden. So anyone who comes to you and says, I have this one probiotic that is going to fix all your problems, they do not understand the microbiome. The microbiome is a beautiful garden that relies on each other's excrements and pollen and all these things and is very complex. But you can tend it overall by getting it good fertilizer, which is good food.
Wonderful. And I was going to ask you, how bad is that Diet Coke really?
It may not hurt you today, but next week it may impact you.
Okay.
Oops, I know people hate me. I do. I get no Christmas cards. They're like, you destroyed all the good things in my life.
All right. Okay. So we've talked about bloating, abdominal pain, constipation. You kind of brought up those kind of key things that I'm seeing with a lot of patients. And, sometimes women are saying, it's like I'm 5 months pregnant by the end of the day. What in the world is going on? So you mentioned some specific recommendations like 50% fruits and vegetables. Let's see. You also mentioned eliminating dairy. Now, is that for everyone or is that for just those who are lactose intolerant?
Everybody, 100% of us will lose the ability to break down lactose sometime between their 20s and their 40s.
Really?
Nobody gets away with it. Nobody.
Really?
But our bacteria can make up for it sometimes if they're the good bacteria. And that's why we've got to constantly provide the nutrients for good bacteria to continue to grow. And if you want to get the most bacteria for your buck, then that is just simply eating yogurt every day. And if
like a Greek yogurt or cottage cheese. Is that even good?
Well, it's brought a lot more salt than you think.
Okay.
So my actual recommendation is kefir. Kefir is a very tart liquid yogurt that you only need a small amount. So it's actually the most economical because you only need a quarter cup mix it with some granola or something like that to eat it. And it comes in blueberry, strawberry, etc. But that'll give you about 10 to 100 times the bacteria, the good bacteria, as doing yogurt. And so, and it'll cost you $3 a week. So there's nothing to it. The other thing we can do for the bloating is using good old fashioned baby gas drops. So simethicone is my favorite drug. I use it as an inpatient, I use it an outpatient, I use it in the endoscopy unit. I use it on Facebook Messenger for people who message me about this horrible bloating and I look 7 months pregnant. I'm like, yeah, that's called gas. And so take some simethicone. You can't overdose on it. It doesn't interact with any other medicines. I literally inject it into the scope all day, every day while I'm doing colonoscopy so I can get rid of the bubbles, and they disappear like roaches when you turn on the lights. So it gets rid of all the bubbles. You can bring it with you when you're traveling. It is great. So it'll help you if you're like, but I gotta have that ice cream. Fine, have the ice cream, but have the simethicone in your purse.
So are you having patients take it prophylactically twice a day, or they just take?
Those that are really bothered by the gas, absolutely.
Okay.
And then, of course, you can do Beano, things like that. So it just depends how bad the gas is for you. But it's easy to do. It's over the counter. It's available everywhere. It's cheap. It's old. It's been around forever.
Right.
So I love that drug.
Okay. You also talked about hydration. We've got to drink our water, which we just talked to an ophthalmologist and we learned the same thing. Like for our eyeballs, we have to drink our water too. Drink your water, ladies. You also mentioned cutting alcohol, and we are in a big wine society. You know, it's just so popular to drink and so cool to drink. I haven't had a drink in well over a decade, and it was just a personal decision. It had nothing to do with health. But I find it interesting that so many people have a hard time with it socially. I haven't. I can still be the life of the party and have a good time, which is like,
no doubt about it.
It's just like a fact. It's like, okay, I don't drink. No big deal.
Right,
you know?
Right.
So don't take it personally. But talk to us about how it affects our gut.
Oh, well, right now, if you look at the top cancers that are increasing, it's going to be colon cancer, especially in the young. So it's the number one new cancers in those younger than 50, which is crazy. I had a 36-year-old last week with a horrible cancer. So we've got colon cancer, we've got pancreatic cancer, gallbladder cancer, esophageal cancer, rectal cancer. Guess what they all have in common? Alcohol. Alcohol dramatically increases the risk of all of these cancers. So that is the main reason that I see, because I want people to have a long, fruitful life and not die young, right? And not lose them for something as silly as wanting a margarita with the girls or wine on Thursday night. So that the second one is I'm a hepatologist. So I love the liver, and there is nothing worse on the liver than pouring alcohol on top of it. The beautiful thing about the liver is it can literally regrow itself if you stop whatever's damaging it. So if you give yourself a healthy environment of good hydration, good nutrition, the liver can be grown back within a year. So I've had patients on the liver transplant list who stop alcohol, we cure their hep C, they start eating right, get rid of their fatty liver. And a year later, I'm like, girl, you have a normal liver. 2 years from there, I say, now you are healthy enough, you could donate half your liver to your grandbaby. And it's just amazing. So why would we get rid of that resource by drinking alcohol regularly? Alcohol also dehydrates us. Alcohol burns the entire esophagus, just like soda does, just saying. But it's my thing that there's the whole Disney princess thing with the bubbling vat of things saying, here, drink this, sweetie. So it was actually soda the whole time, you know. So it causes heartburn. It causes the lower esophagus to open, which makes splash, splash, splash. It's like opening up the washer as it's spinning around. Of course, you can get splashed in the face, and your esophagus gets splashed in the face with alcohol too. Alcohol, tobacco, mint, and fatty foods will all make the lower esophagus open and make you feel a lot more reflux.
Okay.
So I don't see any benefits of ever drinking alcohol.
Or sodas.
Or sodas. Zero. Sorry.
Sodas.
You can still have your coffee. I'll give it to you.
I do not drink coffee. I don't drink coffee, so I need another caffeine alternative.
Got it.
Okay. You also mentioned weight-bearing exercise. And so talk to us about that, because I talk to patients all the time about it's a metabolic organ. It's going to help to maintain our insulin. It's going to help with our bones and our stability so we're not falling and getting a fracture. But it's going to help our gut too?
Well, yes and no. So I'm If you're not moving, your gut's not moving. So if you're sedentary, you're on a plane, you do long travel, you were injured in a, automobile accident, you had a surgery, you don't move, your gut doesn't move. You've already figured that out. So that's movement. But then the actual lifting weights, why I think it's important is because of the bloating, which is the number one complaint of postmenopausal women, right? And bloating has to do not only with what's going on with the inside, but what's going on the outside to hold it in. So if you are doing core exercises and you are on one of those half circle balls as you're lifting your weights, your core and your abdominal muscles are going to be very strong. Because you're not carrying around a baby all the time, right? You're not doing the things you were doing in your 20s when you're in your 50s. And so it actually strengthens you so you have less symptoms of the bloat. So it's not because of what it's doing to the GI tract per se, although all those amazing things that you already talked to your patients about, Dr. Moyers, but it also gets rid of the physical side where you look pregnant. You can't look pregnant when you've got abs of steel.
Right. That's fair. Yeah, that's fair. So how long does it typically take for someone to feel a difference if they make these changes?
Oh, yeah. It's amazing. You literally can change your gut microbiome within days, which is so fun to me. So we've got lots of studies taking microbiome analysis and doing fecal microbial transplants, taking poop from a healthy person, put an unhealthy person. Same thing for somebody with obesity, and you put in the microbiome from a slender person, they start losing weight. It's like, oh my gosh, it is amazing and magical. So it literally starts working days later. So you'll feel the improvement within weeks of changing your diet and changing the way that you eat. And then doing simple things like don't drink from a straw. You're bringing in more water. More air, and then don't drink sodas because you're drinking air, you're drinking bubbles. So if you eliminate straws, you eliminate sodas, and you eliminate lactose, you're going to see massive improvements in your bloating within 5 days.
Wow. This is big.
It is ginormous. So I love empowering women that you don't have to live like this forever. There is a lot under your control. You just didn't know it. Nobody's talked to you about it. And I'm so sorry. And they want to say, I'm not broken or I'm not doing anything wrong. I'm like, actually, you are doing some things wrong. You could improve this. You could tweak this. You could tweak that. And once you do, and once you start drinking water and that's just normalized, you will save so much money at restaurants and movies. And just like you don't drink alcohol, you're saving money. And then you're just known for that. And people don't question you. You're like, of course, that's what Carolyn is having. She's having water. She's having soda. That's just what she does.
Yeah. Yeah. So is abdominal pain and menopause ever a red flag that needs to be investigated rather than managing with lifestyle? And I have my own opinions about this because, abdominal pain can be so many things where you can have an endometritis, we could have, ovarian cancer. There could be so many things going on. But as it relates to the gut, what do you see?
Oh my gosh. Abdominal pain is so prevalent, right? So it is going to be 50% of any gastroenterologist practice is abdominal pain. And so we do have this new young colon cancer that we did not have. I would find colon cancer in a 30-year-old once every 5 years. Now I'm finding it, once a month. So we are seeing much more intense disease that we never saw before and much more scary. So if you have a new abdominal pain you've never had before, please get it investigated by someone. Please don't blow it off and just take simethicone. You do take simethicone if you ruled out you don't have inflammatory bowel disease, you don't have Crohn's disease, you don't have ulcerative colitis, you don't have colon cancer, you don't have diverticulitis, appendicitis. There's so many things that we diagnose and treat. So get it evaluated. But if they say everything looks good, then these are the things that we go to. But these are not the first line things you go to. This is if we ruled out other things for a new abdominal pain. Now, if it's a chronic abdominal pain you've always had and it's just worse with menopause, let's try these other things. But if you have that with rectal bleeding or with weight loss or with a family history, we don't mess with that. We got to get in and get it checked out.
Right. Absolutely. Well, you're bringing up so many important topics, and I want to kind of talk about each one individually. So you mentioned the microbiome, and I feel like it's this mythological beast at this point because there's supplements and there's tests and there's protocols and there's entire Instagram accounts. But let's reset. What do we actually know with confidence about the gut microbiome and menopause?
We are at its infancy. Truly. This is
Okay.
Watson and Crick DNA. This is the very, very beginnings. So, truly measuring hormonal levels and where we are in the cycle, perimenopause and menopause, and how it relates to what is our balance of firmicutes and bacteroides. We're just starting because so much of the analysis with women in studies, as you know, we have not been part of them for only the last 30 years. So it's a big black box of nobody knows, and everybody claims to be an expert, and everybody's trying to sell you a supplement. Everybody's trying to sell you a thing. And that all comes with dollars. That all comes with profit. Guess what? If somebody's selling you something very expensive, they are just trying to take advantage of you. Because what I am selling you is eating fruits and vegetables, which I make $0 off of. I'm selling you use some kefir. I make $0 off of. I'm selling you to walk. I make $0. I'm telling you to lift your weights and to stop drinking sodas and straw. That's as simple as I put it. There is no magic bullet, but tons of people are trying to take advantage of people by knowing just enough to sound like they know what they're talking about. In reality, we do not have the whole story. We just have bits and pieces. So that's why I focus on feeding the good microbiome and not feeding the bad microbiome, not taking a bunch of antibiotics to blow up the balance between those two. And just trying to minimize drugs as a general rule, because all drugs are interacting with our microbiome. How's the environment interacting? How's our air quality interacting? How are the plastics interacting? I'm so guilty. I microwave everything in plastics. I just don't have time to move everything to glass. Is that contributing? Yeah, it probably is. So I'm guilty of not being perfect either, but we're all doing the best we can, especially many of us that are busy moms. We're just
Yeah,
all trying to get through the day. But if you
sure.
have a choice between a donut and an apple, you know which one you should pick.
Yeah. So when we think about prebiotics, probiotics, postbiotics, like everybody's wanting to take a biotic of some sort.
Yeah.
Do you think about these differently for menopausal women?
I really don't. I really don't. I think that hydration is the biggest key for menopausal women. I think that getting enough water so that you can get everything moving is going to be much more important. And then just getting some sort of probiotics and or prebiotics is going to be the most important. And then lactobacillus is the one that's been studied the most. So if you want to stick with one and one only, do that. But that is in 100% of yogurts. And then if you stick with an organic yogurt, they usually have about 5 to 7 different strains. And if you go with kefir, it's got about 15 strains. And so that's why more is sometimes better, but not always. And if you start drinking a cup of yogurt a day, you're probably going to worsen, or a cup of kefir a day, you're probably going to worsen your bloating because you suddenly changed your microbiome in this garden where you moved it from a tropical thing to a desert display. Don't do that. Just
Right.
sprinkle in stuff.
Yeah. My
And
kids love kefir. That's one I just don't really go to, but I do the whole Greek yogurt, but I could totally switch to some kefir.
Absolutely. And then fiber feeds the good microbiome too. So if you're looking for a crispy snack, just get some low fat Triscuits. Just get some frosted mini wheats and keep them in a little baggie in your purse or in your car. And that's something to munch on. That will also bang for your buck of improving your microbiome and pulling in more water into your colon and keeping your bowels moving regular.
Okay, I'm glad you brought up fiber because we talk about fiber a lot in the practice, especially when we start seeing our cholesterol panel rise and we're talking about our gut health overall. And, typically I tell patients to aim for 25 to 30 grams of fiber a day. And most of us are getting woefully less than that. Like we're counting our macros. Nobody's paying attention to the fiber.
I know, it's so crazy because you're going to feel so much better if you are getting that 25 to 30 of fiber in a day. And so that's going to be, you're going to have to do a cup of broccoli with your dinner. You're going to have to do a pear with your lunch. You're going to have to do 2 pieces of fruit with your morning breakfast. And boom, you're almost there, and then just add one more thing to it. So it's not that hard, but it does take a conscious effort. So if you look at your plate and it's brown and it's fried potato chips with fried nuggets with fried chicken, yeah, there's no fiber there,
Right.
So this isn't hard. And if you add a piece of lettuce to your burger, that's not going to get you your fiber. It has to be a bowl of fiber equivalent at least 3 times a day.
Yeah. Yeah. Okay, perfect. And you make it sound so easy. Like we can totally do that.
Absolutely. This isn't hard. This isn't
Yeah.
expensive, but you do have to be intentional.
I want to pivot to something you brought up a couple of times now, and that's March is Colorectal Cancer Awareness Month. This is not going to make it out until April, but it's always important to have these conversations. And you've mentioned several times that the statistics have shifted in ways that we should all be paying attention. So let's talk about colon cancer screening. Let's talk about why we're seeing it in younger people, what is happening, and what do we all need to be doing for our health and our screening.
Yeah, great question. And March being colorectal cancer awareness, it puts it on the front of everybody's mind. And of course, we've lost multiple celebrities to this in the last 3 months and in the last 3 years as young celebrities specifically. So I'm so grateful that it's bringing it to light and conversation. So it's no longer a taboo topic to talk about colonoscopy. There's all the jokes about the colon prep and, how amazing it is. And what's your cocktail for the evening? Is it Miralax or Go Light? And it's just a thing, but it is the ultimate colon cleanse. So we got to clean out the colon. So colonoscopy is the Cadillac of colorectal cancer screening. The reason that is because not only do we go in and look at the entire colon starting at age 45 if you have no risk factors, but we also get to remove precancers, which is amazing. We can't do that for breast. We can't do that for brain. We can't do that for lung, bladder. And there's nothing else that we can remove the precancers as we go and then be able to decide, gosh, you had more than 3 polyps. Maybe we should do your colonoscopies every 3 years and not every 5. Or gosh, you only had 1 polyp and it really wasn't that big and it wasn't that concerning. Let's do yours every 7. Or gosh, your colonoscopy was totally normal. Let's do your colonoscopy every 10. So that's the Cadillac. The next one down the line is the FIT testing. So that's a stool testing. That's a little Cologuard box that you all have seen advertised during the Super Bowl and everything else, right? So that is a screening test for cancer. And so if all you care about is, do I have cancer and am I one step away from needing chemotherapy, radiation, and a colostomy, then that's fine. And we have to do that maybe annually, maybe every 3 years. We just don't know. And if it's abnormal and then we do a colonoscopy and it's normal, what does that mean? Again, we don't know. We've only been using this test for about 10 years. So we just don't know, but we know the most about colonoscopy. Then you can also have x-rays. You can also have a colon x-ray CT colonography. That's looking at shadows. So they might see a stool ball and say, oh, that could be a polyp, that could be a stool ball, that could be a cancer. They don't know. And then you end up with a colonoscopy anyway. So basically all these screening tests, you end up with a colonoscopy anyway. And so as a gastroenterologist, I'm biased because I like to just get in there, get after it, see what we're really dealing with, and take samples of anything that looks peculiar to us. So again, most people, starting age 45, most people, if they have no colon polyps at all, will just repeat it every 10 years. But honestly, I'm starting to see the writing on the wall that we're going to look at a lot more personalized healthcare recommendations. We're going to look at people who are sedentary and have a poor diet, and we're going to want to screen them more. Obesity, we're going to want to screen more because we're seeing a lot more colon cancer if people are obese and sedentary. And honestly, that's the biggest signal that is showing up for the young colon cancers. But the guy I had last week who was 36 years old, he was fit. He was healthy. He was eating natural food. And so I immediately thought, this has got to be genetic. And I asked him about it. He said, well, my sister had some sort of 23andMe and they said something about Lynch. And I was like, aha, there we have it. I got his tumor markers back a day before yesterday, and he does have Lynch syndrome. So ask your relatives when you see them at the holidays, hey, anybody got colon cancer, ovarian cancer that I should know about, and just put it in the back of your mind that maybe you need to start getting screened in your 40s. Visit with a geneticist. They do amazing work, and they can tell you what are your risk factors. So I wouldn't completely trust 23andMe and things like that, but sometimes it does give you a little hint of what's going on in your family.
So, what are the symptoms of early colon cancer that women often dismiss and maybe attribute to something else, like, say, perimenopause or just PMS that seems to be worse?
Absolutely. Luckily, we're not seeing the increase of the females with colon cancer at a young age. Right now, it's more the men. Now, the women want to be screened because we're going through so many symptoms. We're like, please answer this question. So honestly, women will show up for a colonoscopy 10 to 1 faster than a male will show up for colonoscopy. So the symptoms that we're looking for, though, are new bloating, new abdominal pain in the setting of rectal bleeding. Never, ever, ever blow that off. If
Right.
it's bright red blood that you see and you've had a colonoscopy last year and you've got known hemorrhoids, because all of us girls love hemorrhoids who've had babies. Hemorrhoids are not a bad thing. Hemorrhoids are God's little bumpers that keep you from squirting on yourself when you sneeze or you get up. They actually add some continence. So you want those hemorrhoids. You just don't want them bleeding all the time. So, so if you have new bleeding and you've never had a colonoscopy, please get one, because that may be your only sign. If we find colon cancer when there are no symptoms, just from screening, and we find an actual cancer that day where you had nothing going on, we are able to cure it 90% of the time. If we wait until there's symptoms, bleeding, weight loss, something going on, it's the opposite. We're only able to cure it 10% of the time. So the earlier we get in, dramatic difference in cure rate.
So I'm curious, in the last couple of decades, is there a significant change in the survival advantage for colon cancer? Like, cervical cancer, we've had a huge shift. Breast cancer.
Yes, we have seen improvement in survival because we're getting so many new chemotherapeutic agents with checkpoint inhibitors and other things like that. So we're seeing the incidence is climbing again, which we're like, what? But being cured is overall improving because more people are getting colon cancer screening. They are getting either a FIT test annually or every 3 years, or they're getting a colonoscopy. So we are diagnosing it earlier. So less people are dying from colon cancer, which is wonderful. And it really gives me a happy place in my heart to know that we are making an impact. We are doing good by removing these precancers that we've been doing for the last 20 years.
Yeah, amazing. Okay, let's do some myth busting. Are you ready?
Yes, please.
Okay. Colon cleanses, these 3-day juice detox cleansing kits for wellness suites, or they're going and getting the colostomy where they're like flushing out their poop. What in the world?
Oh my gosh. Everybody wants a quick fix, whether it's a pill or something up my bottom. I don't know. So yes, we see some crazy stuff, especially going with the traveling medicine, the stuff that people do going down to Mexico to have the ultimate cleanse. And I see perforations. I see horrible infections. I see salmonella. I see E. coli. I see C. difficile, which will give you 15 bowel movements a day and is hard to treat and may go on for 3 months. So please do not do a colon cleanse unless it's for your colonoscopy. The other part of this is you hear about the 15 pounds of something that's spackled on your colon. What are we talking about? There ain't 15 pounds of poop in your colon. I'm sorry. And it doesn't need to be despackled. Just have your colon prep. Do it right, do it well, so that we can find those little polyps and prevent you from ever getting an ostomy or meeting our wonderful oncologist or colorectal surgeons or ostomy nurses. I don't want you to know them. I want to get ahead of it and remove it. So that's the time I want your colon to be spick and span clean. There's a cool bowel prep that was made by one of my colleagues called Happy Colon, where you can actually do a bag of chips. You can do some oatmeal, some mac and cheese. They're specially formulated to do with your bowel prep. So not that I get a plug from that, but just throwing it out there. There's lots of different bowel preps, and we will find the one that works for you.
Nice. Okay. Yeah, the bowel prep was the worst. I remember showing up for my colonoscopy and they said, "How are you this morning?" And I said, "I'm tired and my ass hurts." Like,
exactly. And please get some diaper cream ahead of time. They ain't just for babies anymore. So put it on your little bottom before you start that prep, please. Protect those tender areas.
Yeah. So it sounds like, in terms of colon cleansing, it's feeding the good bacteria, drinking your water, moving your body. So what's actually normal when it comes to bowel movement frequency?
Yeah, we go by the 3x3 rule. So some people, it's going to be you have a bowel movement at least every 3 days. So if you go to 4, that's abnormal. So some people literally just have a bowel movement every 3 days. And then the other thing is we don't want to have more than 3 bowel movements in a day. Some people have more active bowels and are more sensitive to what's going on in the news or the environment or the chills or the children or the whatever's happening, And so if you're having more than 4 bowel movements in a day, that's abnormal. So it's just the 3x3 rule, and you'll see where you fit in. So you do not have to have a bowel movement every day like your great grandma told you. It's okay. It's okay.
All right, let's talk about the summer travel gut. Maybe let's not limit it to summer, just the travel gut. There's something that we hear about every year. It's vacation season and you go on a trip and it just wrecks your digestion. So, what can women do to protect their gut when they're navigating airports and time zone changes and unfamiliar foods?
Yes, yes. Number one, hydrate. Drink, 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 drink. Just like your mama told you, and on the airplane, don't drink the alcohol. Don't drink the soda. Ask for water. It's super boring and it's super affordable. It'll cost you nothing. Maybe you could buy more souvenirs or whatever makes you happy. Second thing is have some Miralax in your bag. Just the powder. Nobody's going to take it from you at TSA. You can add a little bit to the kids' food, to your hubby's food, to your partner's food, to yours, whatever you're drinking. Add it to your iced tea or your water or your coffee or whatever. Add a little bit if you're prone to getting a little constipation. If the bowels haven't shown up, and they usually show up every day and they didn't show up today, go ahead and do that. Have that simethicone. Simethicone comes as liquid, it comes as chewables, it comes as capsules, tablets, all these things. So have it in multiple formulations and start handing it out to your travel buddies and yourself so that you can prevent the bloating and still feel good in that bathing suit when you make it to Jamaica and feel good about that. And then look for things that are your norms. So when I'm in the airport, I will go buy the Chobani yogurt because I'm like, I need some yogurt. Now they will make you throw it away at TSA. So don't try to get through it. So be ready to purchase the $4 Chobani that usually costs 74 cents, but do that. And then look for fruits and vegetables everywhere you go and put yourself on a limit that yes, you're seeing these amazing desserts that you would never make for yourself at home. That's great. But you have to eat your pear in the morning in order to order the dessert tonight. So it's intentionality and planning of trying to get those 3 to 4 fruits and vegetables in every single day, even while you're traveling, even while you're eating the steak or the seafood or the desserts, but trying to keep some normalization of what you usually do. And for your snacks, don't just do the Cheez-Its, but actually pick up the Triscuits or something with extra fiber in it so you can continue to feed that good microbiome. And look for that beautiful rainbow. Look for the blueberries. Look for the strawberries. Look for the kiwi. Look for things you wouldn't normally eat that are delightful colors and delightful to expand your microbiome with more diversification. And that'll prevent you from getting up other infections that you may get while you're traveling. If you're traveling at an area that you are expecting to possibly get a little exposure, like I was on a cruise ship last week, I handed out Pepto-Bismol tablets to my whole family. So we took those. I didn't do antibiotics, but I did something that's antimicrobial to prevent the cruise ship diarrhea that you might see.
Okay, you've given us a lot of great ideas for a protocol, a travel kit.
Yes. It's
Yeah,
real.
and it's all fairly simple, right?
Yes. That's all I recommend is simple stuff.
Yeah. Well, Dr. Sears, this has been exactly the conversation I hoped it would be. Practical, clinical, a little bit funny, and just genuinely important.
It is funny. Yes.
Right? Right. I'm surrounded by boys in my house, and yes, farts and poops are always funny. Thank you so much for your time and for the work you do for women and for veterans.
Thank you, Dr. Moyers. Thank you for all that you do every day for women, for your patients, for each other, and for what you're doing at Sky Women's Health to help women get what they need to feel better.
Oh, thank you so much. Okay, listeners, here is what I want you to take away from today. Your gut is not betraying you. It's responding to a hormonal environment that is fundamentally changed. And with the right information, you can work with it. Dr. Sears' bottom line, she told us eliminate our dairy and our alcohol, pick up the weights, take a walk, drink your water, eat your fruits and vegetables, drink some kefir, keep that simethicone in your cabinet, and for the love of all that is good, get your colon cancer screening done, please, especially in your 40s, especially if you've been putting it off. I have these conversations daily with patients. They're a little annoyed that I'm as thorough as I like to be, but I think that it's so critical that we get on the front end of this. If this episode has helped you, please share it with a woman in your life who's been dealing with unexplained GI symptoms and chalking it up to just getting older. It's not just getting older, it's menopause. And now she'll know what to do about it.
Yay! Thank you so much. This is such a pleasure. I love helping women.
Absolutely. Thank you. Until next week, be well. Thanks for listening. This episode is sponsored by Sky Women's Health. If you love this episode, follow the show so you never miss one. Share it with the women in your life and help more people discover it. Let's make it binge-worthy.